Hello, my name is Josephine Tao, and today I'll be talking about the health belief model. This is one of the most widely used health belief theories in public health and is based off of the values and motivation of an individual. It explains a person's behavior when faced with a behavior change, such as eating healthier or being more physically active. This model is unique because it was made by social psychologists in the 1950s to predict health behaviors. These psychologists worked under the U.S. Public Health Services to investigate why their prevention and disease detection efforts did not draw much attention. Fortunately, the health belief model was adapted to explain the behavior of reluctant individuals. So what is the health belief model? This model revolves around 6 constructs or ideas. They are perceived susceptibility, perceived severity, perceived barriers, cues to action, self-efficacy, and perceived benefits. Perceived susceptibility is where the individual considers the negative consequences of a condition and how harmful it is. It is also where the risk factors and the target population come into play. So let's use STI and HIV screening as an example. In this construct, an individual is aware that they may be exposed to an STI or HIV. Perceived severity is a person's belief on how serious a condition might be and what the consequences are. In other words, it is also one's perception of the extent of harm from a disease. The individual must specify consequences of the risk. For example, the risk of contracting STIs or HIV is severe enough that the individual will avoid getting it because it might mean that they need to pay a lot for medication or have expensive treatment or a lot of pain. The next construct is perceived benefits. This is one's belief in the efficacy of the advised action to reduce the seriousness of the disease or harmful state. It's what the individual believes to be the benefit of stopping the behavior. Furthermore, the individual needs to determine what action they need to take. In relation to our example of STIs and HIV, this means that a person believes the STI or HIV screening is beneficial. It will let them get early treatment and prevent the spread of infection to others. Next on our list is perceived barriers. This is essentially the perceived cost or hindrances of the new behavior change. An individual may be reluctant to get a screening because they might not have adequate transportation, are not aware of clinics that offer the screenings, or might be embarrassed to go to the clinic. The last 2 constructs, cues to action and self-efficacy, were added later in 1988 to help accommodate unhealthy behaviors such as overeating. So cues to action are the forces that make an individual feel like they need to take action. It's what motivates the person to change and is a strategy of preparing for the behavior change. These cues might be seeing an advertisement or a flyer for screenings or receiving reminder texts from a public health campaign. Self-efficacy is a person's ability to believe they can achieve the behavior change. A patient will be confident on going to another appointment in the future or know how to identify an STI and educate others about HIV. Overall, the health belief model is really useful and can be used for promoting bicycle helmet use, vaccinations, or even condom usage. This was the first theory made for health-related behaviors. It predicts behaviors based on the 6 constructs I just listed, and is commonly used nowadays for program development and can be even used for our program development project in this class. The information I used for this video was compiled from our textbook and the University of 20's website. I hope this video helped to explain the health belief model in a different manner for you. Thanks for watching.